Hey, good Monday. Good Monday. So here I am. Where you guys like me to be, in the mobile office, pulling out of the parking lot after a long 12-hour day of work. I got my laundry here. You guys who love my shirts, I got my shirt fans. Can't give you any good movie tips. I don't know any right now. Let's see. Here's the complex. It's hard to see, but there's the infusion building. See that? Hope you all can see that infusion building. Best place in the world to get an infusion. If you need any medicine, intravenous, whether it's IV fluids because you're dehydrated or tired, whether it's Cytoxan because lupus has got your brain or your kidneys messed up, or whether you got rheumatoid arthritis, or whether you got giant cell arteritis, or psoriatic arthritis, or ankylosing spondylitis, or even asthma in some cases where your IgE level is too high, or there's so many things now. Neurologic diseases, if you have MS, if you have ALS or Lou Gehrig's disease, if you have myasthenia gravis, we have infusions for you in a comfortable, warm atmosphere, very much like your living room, comfy chairs with massage. They're warm, they got temperature control, warm and cold, and friendly staff with probably 40 years experience between them, maybe more than that. We have drinks, we have snacks, we have meals. Whatever you need, we run what is the same as a teaching hospital in my office, and there's no disease we don't treat, we don't hide behind it, we are not lazy. You know, I got a question this morning, and it said, why are so many rheumatologists clueless? Well, gotta be honest, that's a darn good question, because I had the best training in the world. I went to the best training program in the world. I was trained by some of the smartest, most knowledgeable, most caring rheumatologists in the world. I was trained by Bruce Hoffman. Bruce was the chairman of MCP when I was there. I was trained by Dr. Larry Leventhal, who is the chairman of Graduate Hospital. I was trained by Dr. Ralph Schumacher, deceased, but he was the chairman of University of Pennsylvania and the VA in Philadelphia. I learned how to start infusion centers from Dr. Roy Altman in Miami when he was there. I learned about hepatitis C and vasculitis from Len Calabrese, and I learned about muscle diseases from Robert Wertman. Boy, I'll tell you, I just listed you the Babe Ruth and the Lou Gehrig of rheumatology, and I had the honor to train with these men. In fact, when I published something in the New England Journal of Medicine back in 1993, George Ehrlich came from New York. He was a professor at NYU and a professor at Penn, and he was the expert on that topic. He came to help me. Today's doctors, first of all, they want to get out at 4 o'clock. They want to start late. They don't want to do too much work. They don't want to get their hands dirty. They don't want to sweat. They don't have their own x-ray machine. They don't read their own x-rays. They don't have their own microscope. They don't look at their own fluid. If you don't look at your own fluid and examine your own patient and take your own x-rays and review your own x-rays and go to the hospital to see your own patients, how on earth can you be a good doctor? I have no idea. Well, these things come back to roost, and I was asked that question this morning based on some poor lady who had unnecessary knee surgery. Now, I talked about somebody getting knee surgery last night for an attack of pseudo-gout. I've seen 2 patients from a nearby orthopedist get a cast on a gout attack, okay? The patients took a saw and cut off the cast on both occasions. That's one horror story. Horror story next one. A lady flew in with her husband from Greece because they have a restaurant down in the Jersey Shore, the South Jersey Shore. 6 months a year they have a restaurant, and 6 months a year they live in Greece. They walked in the office 20 years ago and they said, hey, I want some Remicade because I get it in Greece. So I said, gee, I just need the information to prove you need it, and I'll be happy to take care of you. The lady pulls out a bone scan and says, see, here, I got bilateral sacroiliitis. Well, I looked at it, it was normal. I said, that's not your sacroiliac joints, those are your kidneys. And they were perplexed, they were dumbfounded, but guess what? That doctor in Greece is now in prison. He told everybody the same story. So of course I went back and said, well, why'd you go see the doctor? What hurt you? Well, I didn't really feel that good. Nothing really hurt that bad. Anyway, long story short, the lady did fine with nothing, but she had to go through drug-induced lupus in the course of the whole thing. And I got one last one for you, and this is crazy. I get a referral from somewhere in Cape or Atlantic County. A patient drives up, says, Doc, I'm here for an evaluation of my rheumatoid factor test, so my doctor thinks I got rheumatoid arthritis. So I said, it was actually a woman. I said, ma'am, do you know, why did the doctor order the test? What was hurting? Oh, nothing hurts, but they did the test because I had breast cancer. So anybody who knows anything in medicine would know that if you have breast cancer, we're not interested in your rheumatoid factor. And if you have rheumatoid arthritis, we're not looking for breast cancer. So the way this story goes, I started asking some general medicine questions. So tell me about the breast cancer. ER positive, PR positive, HER2 positive? No, doc, I don't know because they never did a breast biopsy. Well, if you never had a breast biopsy or a lumpectomy, how do you know you had breast cancer? Oh, well, that was from my lymph node biopsy. Lymph node biopsy? How do you know what kind of cancer was in your lymph node? Oh, I don't know, doc. Well, the patient who had the rheumatoid factor, who had the lymph node cancer, turns out to have had a dry mouth with dry eyes, and on salivary biopsy, that person had Sjogren's syndrome, and on corneal staining, they had Sjogren's syndrome. So this is a true story of a patient who came to me for evaluation of rheumatoid arthritis, who was treated for breast cancer with chemotherapy and radiation, never had the breast biopsy, who actually had lymphoma related to Sjogren's, which, by the way, 44 times the increase in the population of Sjogren's patients get lymphoma compared to the normal population. And this person, because they received the wrong chemotherapy, it did help their lymphoma. However, now they've had so much of those drugs, they can never have them again. But from a standpoint of dry eyes and dry mouth, that is the least of their problems. So, you see, there is a lot of stupid out there, and there's a lot of lazy out there. And you can't fix stupid, and you can't repair lazy. And you know what? It doesn't matter what field you're in. It doesn't matter if you're a doctor, lawyer, politician. It doesn't matter if you're a teacher. It doesn't matter if you're a painter, cab driver, Uber driver, Lyft driver. It doesn't matter what you are. It doesn't matter if you're a comedian, or it doesn't matter if you flip burgers at McDonald's. There's hard workers and there's slackers. So unfortunately in medicine today, healthcare is all screwed up. Medicare pays the doctors very little, and they audit the doctors the most. If there was a single payer system, you guys better all run for the hills and pray you never get sick, because nobody will treat you. And just like the people come from Canada to here to get their knees replaced because they got to wait 2 years over in Canada, I'm finding out half these people don't need those replacements anyway. But nonetheless, you won't get anything done fast. And right now we have denials of almost everything we order, and it's sort of routine these days. So the system is broken. Not broke. The system has tons of money, but it's broken. Money is misallocated and wrongly allocated, and the wrong people get paid the wrong amount, and it goes on and on and on. But I believe the person who asked me this was Annette, whoever Annette is. Annette, I feel you. we are in a horrible state of affairs to find a good doctor. And when you find a good doctor, and since I'm a good doctor, don't forget, I'm your favorite Dr. Soloway, the patients travel. We have enough patients that come from out of New Jersey to make a whole practice. I mean that. I sincerely mean that. And it grows, and I don't even understand it anymore, because I work my hardest. I never thought I'd be the best, but I guess when I'm 100, if I'm still swimming, I'll be the fastest 100-year-old swimmer. So, I don't know if I'm half as good as I am, but there's a lot of people out there that are pretty bad and make me look good. So I thank those people, especially that lady in New Orleans, Louisiana, who was so good and so dumb that her patient traveled 1,350 miles to get diagnosed by me. Anyway, I hope you have a great night. I'm sorry I rambled for so long. And I got to give you guys some new movies to check into, okay? Bye now.